Good evening, ladies and gentlemen. My name is James from the Chinese University of Hong Kong, and I will be your student host today for the webinar. Before we begin, I would like to express my great thanks to the Hong Kong Life Sciences Society for organizing such a fruitful webinar. We are very pleased to have Dr. Cecilia Chui with us today. Dr. Chui is currently the research advisor at the vaccination team of Wellcome Trust London, where she is involved in the team strategies and activities on controlled human infect models. She has worked in various sectors of the global healthcare industry, including academic research at Oxford, pharmaceutical strategy consulting, and project management and research funding bodies. She holds a doctorate degree in clinical medicine from the University of Oxford and a bachelor's degree in biochemistry from the Imperial College London. And today, Dr. Chui will share her insights into the challenges and opportunities of the life sciences early career. And after that, we will have an open Q&A session. So now let's welcome Dr. Cecilia Chui.
Hi, let me just share my screen. Okay, I hope that you see my screen okay. Okay, so first of all, good evening, good morning, good afternoon, everyone, wherever you are. So thank you again for the organizer for having me in this session today. I'm Cecilia and I'm based in London in the UK. We are still in the midst of a lockdown right now, so apologies if my network is not very stable because a lot of people are working from home at the moment. So in the next 20 minutes or so, I'm going to tell you a bit more about my background and what I'm currently doing. And then I hope to give you some idea of what sort of career options are out there with a life science degree. And this is going to be very informal, so do feel free to ask questions in the end. It's just a disclaimer that all opinion expressed in this presentation are my own and are not related to any organization that I mentioned. So something about me, I was born and grew up in Hong Kong, and after the Hong Kong A-levels, I came to the UK, and for my degree, I studied biochemistry at Imperial College London. As part of my degree, I took a placement year working on a vaccines project for pharmaceutical companies called GSK. This is something that students from Hong Kong might find it quite strange because usually there's no options to do a placement year, but in the UK, there is options to do a year out, whether in industry or academic research. So that most of the students find it quite useful to get some extra experience. So throughout the year, I learned about immunology. And of course, as an undergrad, they won't let you do a lot of dangerous stuff, but perhaps unsurprisingly, after that year, I decided to do my PhD in immunology. And very luckily, I got a scholarship to go into Oxford, and I spent the next 4 years looking at T-cell responses in flu, infection, and vaccination. I think looking back, my PhD has been quite stressful, and but I did have very interesting 4 years, including a lot of traveling. I spent some time in China, and I spent some time in the US as well. And after my PhD, I stayed in Oxford and worked in a different lab to do a postdoc on HIV. So for quite some time when I was working in the lab, I was considering whether I should stay in academic research or to do something completely different. I remember a lot of my peers at that time went on to do consulting, but I like the idea of following some of my work of my PhD. So when I was offered a position just next door doing HIV research, I took it, and I think I enjoyed a lot better with my postdoc as I have a very supportive supervisor. But skill-wise, it's still very similar to doing a PhD. So as some of you might know, as most of you might know, so working in academia has a lot of freedom. You don't have to be in the lab 9 to 5. You can be like 10 to 10 or 12 to 12. But yeah, but after all these years in academia, I found that there are things I don't enjoy doing, like feeding cells on the weekend, and also the need to keep a very impressive list of journal publications or to compete funding with other highly intelligent people out there. But like many people, I think that is the only way for me. So seeking to do something else feels quite confusing and quite scary as well. So during my postdoc, I was doing something on the side for consulting companies just to get some extra experience and cash. I was helping them to do research on health systems. And as part of the project, I talked to a lot of physicians, industry representatives, and I found that I really enjoyed talking with people and seeing the bigger picture. So I feel that I really want to develop some different skills other than bench work. So I left my postdoc after 2 years, and I went on to join this company in London. And my main interests are looking at market access. What that means is that if companies want to launch a new product in a new market, so I help them to look at the best way to do it. And in the process that I learn about different markets, like how is Spain like, who is paying the medicine in Japan. So this is I was learning a lot in consulting, and things were moving so much quicker, and they are much shorter projects. So that there were opportunities to do many things in a very short span of time. So, but however, I have always wanted to work on global health. It is partly one of the reasons that I decided to do science when I came to the UK, and I think while working at consulting, knowing a bit more about different healthcare system does make me realize that science is not just about getting the best medicine out, it's also about how to get that medicine to the people who need them. And it can be very challenging in many settings, such as for people in Africa. So I began to explore different ways to transit into a global health career. I talked to a lot of people, some of them I have never met. And I come across this job at Wellcome, and I applied for it and got the job. So in many ways, the job matches my background very well in flu and HIV, and also my experience in project management and strategy development during my time in consulting. So this is perfect. So Wellcome is a research funder. So some of you may have the questions, what is a research funder? So you can see this picture here that a lot of researchers think that research funder are someone just sit and piles of money, and these money are just sitting there waiting to give away. And my mom thinks that I'm a scientist, and my boss probably think that I'm just looking at grant application all the time and also reading a lot of journals every day just to keep myself updated with scientific literature. So what I actually do, so just gonna give you a background with the organization I'm working with now, so Wellcome. Research requires money, scientific research requires money, and the money usually comes from a variety of sources. It can be the government, it can be the industry, it can be private foundations. So Wellcome is one of the private foundation, and the Bill and Melinda Gates Foundation in the US is another example. So for Wellcome, we are an independent charitable foundation supporting research to improve health. Our work is funded from our almost 30 billion investment portfolio. We directly fund thousands of scientists and researchers around the world at every step of their career, from PhD students to senior investigator. And we also fund science from discovery all the way to impact. Our funding scheme offers grants across biomedical science, population health, medical innovations, humanities and social science, and also public engagement. So apart from funding research, we also work with policymakers to make sure that healthcare policies and practices have got that evidence base. So to make sure that health is improved by changes that is evidence based. So what do I do so this is my day-to-day job. So I work, as James mentioned just now, I work in the vaccines program, and particularly in project called Human Infection Studies, which is quite a specific kind of clinical studies that we use to accelerate vaccine development. And at Wellcome, we are interested to move this human infection study into endemic settings. So that is populations in Africa, just to make sure that we're able to develop vaccines that is tailored for this population. So a large part of my work is to project manage, that include to manage the grants that are in our portfolio. So currently I'm managing grants in India, in Malawi, in Thailand, and a lot of time is checking in their progress and to see whether the researcher need any help and anything that we can support them with. And a broader piece of that is to also support the policy and comms work as well. So how this human infection study is going to be perceived by the public. So there's a lot of things that we need to do to manage that as well. Because our portfolio is quite big, so it's really important that we are making the most efficient use of our money. And so there's a lot of strategic planning as well, to making sure that the money that we are spending is going to address the outcome we set out to do. And also that will involve preparing a lot of paperwork to for our management. I think a large part of my day is with meetings. So some meetings with internal stakeholders and meeting with external stakeholders. Because it's a global health, so there's a lot of stakeholders in a global health arena. We work with WHO, my colleagues work with Gavi, we also work with FRF and regulators. So there's a broad range of stakeholders, and it's really important that we know what each others are going on. So a lot of time I spend on having meetings. And of course, like any other jobs, the rest is to report to manager and to manage more junior staff. And also there will be time to do some personal development. So how is it, why work for a research funder? So there are good things and more challenging things as with most of the jobs. So I think personally, the things that I enjoy the most is this is still very close to very exciting science. Researchers came to us about the ideas, and they are very exciting ideas. And that's really the best bit. But because of that, then we need to be I'm more of a generalist. It means that in my PhD, I do flu, and in my postdoc, I do HIV, but now I have to work on malaria, dengue, and typhoid, Shigella. So I have to know a little bit of everything. So that can be quite challenging as well. The second best thing I think is that it really gives me opportunities to make an impact to lower middle income countries, and especially if you're feeling passionate about using your privilege, being educated in a developed world, do something for the people that is unfortunate, less fortunate. This is a real opportunity to make an impact to the world. And also, like I mentioned just now, there's a lot of different players. They all have different interests. So it's very interesting to interact with them and understand more about what their organizations are up to, and what are their interests, and what are the ways that you can work together. And I think finally that Wellcome is a very well-respected organization. It's the second largest foundation in the world, and people are very smart, and I really do enjoy working with them. But I think something that makes Wellcome very special is that people are very passionate about its passion. So people do have a passion about to do something different, to make the world a better place. Some of the more challenging bit, it can be quite busy at times. Some of my colleagues are doing COVID-19 response now, and they are very busy. And some tasks can be, like I said, because we are managing a lot of money, so some tasks can be quite towards the admin work. So there's a lot of reporting to do. And then because we have to interact with a lot of external people, some of the people are much more experienced than me, and some of the people are much more senior than me, like a CEO of a pharmaceutical company, or someone that has a lot of expertise working in WHO. So at times I do feel a bit stressful, and also this takes a lot of confidence as well. Finally, it's not a corporate, so compared with working in consulting, it can be a much slower environment. So I think having reflected on how I transit my career from academia to global health, there's a lot of things that I think that with a science degree you can bring to a global health career. Within a research funder itself, there are very different roles. So my role is a research advisor, but there are many other different roles in the organization, and some of them doesn't require PhD, and some of them will require years of postdoc. So it depends on the technical requirement. Some of the skills that might be useful for you to think about that when you're applying for a research funder, what you want to highlight on the CV is that you want to demonstrate you got the knowledge in the scientific area. You also want to demonstrate that you got experience to work collaboratively, and then you also got the skills to communicate effectively. And because we're working with a lot of different things at the same time, it's also good to highlight that you're able to communicate your ideas and also to influence different individuals in the global health space. And I think a lot of the problems that we're trying to solve now are problems that has been going on for a long time. So it's important that to keep a positive attitude when you are coming into work. So I think for the next part of my presentation, I just want to talk about more general thing like what can I do with a degree in life science? I think the better question to face is what do you want to be? So if you're asking that questions, the good news is that you're not alone. And each of us are different, and some of these questions that I highlight here might matter more to you than the others, like will my family be happy, how much I love science. But I think from my own experience and from my friends' experience, I've observed a few basic things that I want to share with you today that might help students to consider what sort of career is right for them. I think the first thing is you have to know yourself. And we all come with very unique personalities. So don't listen if someone tells you that you have to follow this path or that path. If you know yourself, then you know whether this career is the right thing for you. I think this is reflecting back. This really helped me when I was trying to think whether I want to stay in academia or to do something different. So once you have learned about your personalities, the next step is to learn more about the various options that are open to you and choose the one that you believe that might be the best match. So I know many scientists in training, and for me at some point as well, feel that research is the only options for them. Research is certainly a fascinating career, and it is at the heart of science. But it is not the only rewarding profession that people who are interested in science can do. So on the slide here, I have put in a dozen of exciting jobs that you can choose from. You can work in teaching, you can work in industry, you can work in civil service. So you actually have got a lot of different things to do, but you have to, these are of job titles. What you need to do now is to look a bit more about what is on there, and try to find out a bit more about what is a typical working days like, what kind of training they offer, and what kind of money they can offer. Like that resources all around you that will allow you to dig a bit more into that. So you might look at this list and think, oh, there is no way I can do something like this. But another thing I want to highlight is that you actually have a lot of skills that can be helpful in many careers. There were times in my PhD I lost faith about myself and I feel like a complete waste of time. But this probably happens to a lot of students, especially for girls who are not very sure of their own abilities. But I think with time you can realize that there's a lot of things that day-to-day tasks that you do during your research career are very useful in a non-academic setting, and an employer do look for that. So how is it like working in the UK? So with any place, there are good things and bad things. These are just my personal views. The top thing for sure is London is very international, and you can meet people all over the world. So as a foreigner, you will not feel very uncomfortable. There is also a very good life work-life balance, but of course it depends on projects. There are not as many public holidays as in Hong Kong, but we have got more annual leave. And Europe is just 2 hours away, so it's very easy to go on holidays. Of course, after this pandemic is over, and in this life science place, there's plenty of job opportunities and a lot of interesting research. So I'm sure that you'll be able to find something that really speaks to you. The challenges of living in the UK is that it is a very expensive place to live. The tax is very high, and so are the rents and the transport. And it can be overwhelming for some people. It's being away from friends and family is not easy, and will take some getting used to. Finally, the weather is very bad. Not today, but in the winter, it's probably raining every day. So I just want to conclude by saying that in many ways, I consider myself to be very lucky because my career path so far has been driven by my interests and by things I enjoy doing. And science is fun, and finding answers to questions is fun, especially those answers are going to be useful for humanities. So this is a great career, and all of you have made good choices studying sciences. However, if you don't enjoy what you're doing and feel your calling in somewhere else, your skill will not be wasted, and it's still okay, whatever career that might be. So you can begin to explore your true calling by talking with a lot of people for some encouragement and guidance. If you can, find a mentor. So STEM has always been predominantly a male-dominated area, but it's changing, and there are many success stories for women to find a part in the space. It can still be a problem when women are being stereotyped into specific roles and fields, but one suggestion I would give is to find someone, male or female, who believe in what you're trying to do and try to learn as much from them as possible. And you can also get experience from internship, pay or unpaid, and try out different options there for you. So today, a lot of my advice is based on the work context in the UK because it's most of my experience based on here. But I do think that many things can apply in general to many students in many countries when they plan their first step. I just want to put questions to challenge you that we're in the middle in a pandemic, so what can we do to contribute? And you're in the perfect position to do that. So I hope you find this helpful, and best of luck. Thank you.
All right, thank you so much, Dr. Chui, for the excellent sharing of her insights into the challenges and opportunities of the life sciences early career. So now we'll move on to the Q&A session. Please be reminded to follow the instructions on the participation guidelines regarding how to ask a question. Once again, if you have any questions, remember to click raise hand on the participant panel and keep the icon on. I'll then introduce your name when it is your turn to ask questions. You are also welcome to type in the questions in the chat box so I can read out. So maybe I'll start first. So the market environment is always changing, and as you also mentioned, the global economy and the job markets have been severely affected and impacted by the COVID-19 situation. So I wonder, how should the young graduates and students equip themselves to face such challenges and enhance their own competitiveness? Thank you.
Yeah, thank you, James. This is a great question. So I think this is going to be quite challenging, especially for a lot of people who are going to graduate this year. But I think this is something that is probably going to be quite uncommon to anyone that is trying to find a job at the moment. So I think people don't have to worry too much about that. And I think like what I have mentioned, is very important to make sure that you know that the skills that you have right now is going to match the jobs that you want to go for. So even during the time that it might be quite challenging to find a job, there will still be positions that you can ask that whether you can get some extra experience, even if they might be volunteering for a bit of time. And then there's a lot of remote position at the moment, so that might be one of the opportunities as well. So I think it's important to if in time like this, it's important to keep learning and be curious about the topics, and keep reading. And I think this is something that is quite useful to do.
Okay, thank you so much for your question. So here is a question from Dr. Vikas. So he wants to ask, can you let us know about the different funding opportunities and schemes by Wellcome Trust for the PhD completed candidate?
Sorry, can you repeat that, please?
Yeah,
Sorry.
so he is asking if you can let us know about the different funding opportunities and schemes that is offered by Wellcome Trust for the PhD completed candidates. I think he's talking about for PhDs. Yeah.
PhD. So there are early fellowship that is available. So I would suggest that if you are going to look for a postdoc after you finish a PhD, the best thing is to look for that postdoc position first instead of looking for a funder, because in many cases a lot of project has already come with funding, so you don't really have to find funding yourself. So if you are just a freshly graduate PhD students and you're not looking to apply for independent grant, this will be the easiest things that I would suggest to talk to email the PIs that with the projects that you are interested in pursuing your postdoc.
Okay, thank you so much for your answer, and thank you so much for asking the question as well. So here's another question from Nathaniel. So she's asking, do you know if there is any research funding organizations in Hong Kong that are looking for PhD graduates?
Yeah, this is a very tricky question for me. I don't think I can answer that because I haven't been based in Hong Kong right now. So someone have to help me on that. Is there anyone that can help me on that?
Okay, so probably she can message us, probably privately, so we can forward to Dr. Chui or also other officials in Hong Kong Science Society. So here is another question from Denise. So here she said that she is a girl that is really interested in journalism and literature, but at the same time taking science electives. So she wondered if she should choose her career according to the subjects that she is taking or choose a career according to the interests that she has no academic proof on.
So the question is whether
so she's taking different subjects and she wondered whether she should choose a career according to the subjects that she is taking, like her major, or whether she should choose a career based on her own interests.
I think this is a very good question, actually. I think looking back at people who graduate with me, some of them actually do have careers that are quite different from the biochemistry major. So I think this is something that you don't have to, of course, it might make it easier to apply for a job if you're applying for things that is more closely related to your major. But there are a lot of cases that for my friends and they were doing something completely different right now. So I think it's like what I mentioned in my presentation, it's important to highlight the transferable skills that you have, and you definitely have a lot in your major, I'm sure.
Great, thank you so much for answering. Also thanking Denise for asking a question. So here is another question. So as you mentioned that you have worked at GSK as a research scientist during your undergraduate study, which in terms helps you to decide to study a PhD afterwards. So can you tell us more about how doing research in the industry differ from that of the academia, and how does this internship experience supplement your future career? Thank you.
Okay, thank you. This is a great questions. Thank you. So I have only been working in industry for a year, so my insights on these questions might be limited. But from my experience, I do feel that comparing to academic research, industry research is going much faster. But in academic research, you probably get very attached to your projects. But in industry, the projects that is probably going to be decided by the company direction. So even you might work for something for a long time, then the next day the company might want to do something different. So that is some sort of aspect you might want to think about. But that aside, I think both industry and academic research are doing very interesting stuff. And in a lot of ways, some of my friends do feel that staying in industry is a much more stable environment. And I do know people that if they are couples, they met at university, they're both doing biochemistry. If one of them has decided to go to academia, the other one would probably work in industries. But there's definitely personal choices. But there are views as well that working industry is probably more stable than being in academia where you have to apply for funding every 3 years, every 5 years, and you don't know what to do next. And yep, and the second question is whether the placement year helped with my PhD application. Yes, definitely. I think this is something that that I feel quite lucky as well, because when I was applying for my PhD, it was actually much easier compared to a lot of my friends who didn't do a placement year. So, but what they did is that they, instead of going directly from an undergrad to a PhD, a lot of people would choose to do a master year in between. So you got the experience as well. You can either do a top master, it's a 1 year top master, and you can, or you can do a 1 year research master, which is in the UK, in research master, you probably spend a year going into 3 different labs doing 3 different projects, and it also allow you to have some lab experience. But I think having experience before working for a PhD is definitely very important, because the supervisor will want to see whether you got the motivation or you just don't want to go into the workforce. And importantly, there's a lot of skills that a PhD will be. A PhD supervisor will feel more comfortable to take you as a student, like you know how to do PCR, you know how to do cloning, or at least you have that sort of expectation what that might take, and that might make a supervisor decided to take you as a student. Yeah, I hope that answers your question.
Yeah, sure. Thank you so much for answering. So Justin raised his hands. I'll ask you to unmute so you can ask your question. Please, Justin.
Hi, full presenting. Since you've had quite a stressful event or stressful time with graduate and postgrad thesis, what are some skills you hope to have had before you even initiated researching in graduate or postgraduate studies? Thank you.
Sorry, just my line keep breaking. So can you repeat your questions?
Hi, Justin. I'm wondering what were the kind of skills, like programming skills or some kind programming skills or research applications you wish you knew before you started your graduate studies or your postgraduate studies? Yeah.
Yeah, I think for me, because my PhD was entirely lab based, so what I was doing is mainly feeding cells and and doing flow cytometry and stuff like that. So I don't really have to have I didn't do bioinformatics, but I think if you're going into more data science type of bioscience, then having programming skill would be very useful. And I think it's also important that rather than the skills, I would think that it's good to have some idea of what labs you are going to work with. It might be quite challenging if you haven't know the lab, but there might be ways that you can find out by talking with people. I think understanding more about the culture of the lab, and also understanding more about the so doing some more due diligence about the project you're going to work with in the next 4 years. I think this is something that I wish I work on before I decide to do this project. And you can find out like what sort of productivity this lab has, what sort of do they have a lot of postdocs? Do they have a lot of students? So this is something that you can find out. I think in terms of skills, it's, as an academic, it's really important that you're able to read and also to assimilate information very quickly. So I think reading skills, and also try to tease out the most important piece of information from your reading is very important.
Thank you so much for answering. Thank you so much, Justin, for asking a question. So here is a question from Natalie. She's asking that you mentioned that you were involved in a consulting job during your postdoc. Did you do anything similar during your PhD to gain more experiences, or are these programs more common for postdoc?
Yeah, thank you, Natalie. So I didn't do anything that that is similar in my PhD. But I think when you were working, when you are working for a PhD, you are still a student, so you have got a lot of time to be engaged with club activities in the university. So you can enjoy your university life, and by participating in those activities, you can also talk about a lot of skills that you have. For example, if you are being a chair in a consulting society in Imperial, for example, then you can still talk about your experience, that how you organize consulting projects for the members in your society. So this is also skills that employer definitely look for.
Okay, thank you so much for answering. So here's a question for Philip. So he thinks that the variety of opportunities offered in Hong Kong for life science graduates is very much limited compared to the UK. So do you have any suggestion for those who are based in Hong Kong to reach out or explore those opportunities, for example, in the UK?
Yep, great question. Thank you, Philip. So I think that is a couple of things that you can do. I think if you have got the time and have got the resources, then you can consider studying in the UK. Then definitely it can be a life-changing experience for you, even for 1 year, for a short time. And another thing I would suggest students can do is that I think, which is probably quite unusual for people in Hong Kong, but quite common for people in the UK, is you can write to the people you want to work with. Like it doesn't have to be an advertisement that has put out. It can be just a PI you saw on the internet and you think that, oh, that project looked interesting. I would like to contribute to COVID-19. Can I work for them? And just write to that professor and ask, I got these 2 months that I'm able to spare some time to come into the lab. Would you like to take me? Can I offer some of my skills to you? It is going to be quite challenging looking for something like that come with a salary, but it would be going to be very good experience. I think I did that myself during my undergrad. I went into quite a few labs during my Easter and summer holidays without any pay, and I think this is very eye-opening for me. So I would encourage you to do that. And it doesn't have to be in the UK. It can happen in Hong Kong as well. I think a lot of professors, if they got the time and got the capacity, they will be happy to take you. And yeah.
Okay, thank you so much for your answer. So here is a question from Kate Som. She's asking, most PhD students do basic science and also lab-based research as their PhD projects. Is it possible to do clinical projects? And is it a bad idea to not do a basic science project?
Yeah, this is also a very good question, because I think personally, I have the same struggle as well. So my PhD was quite clinical, which I don't have a clinical background. And compared to the same person, the same person, compared with the peer that is working with me, and he is a clinician. And I do find that he he knows what's going on much more than me, but of course I'm a better technician than he was. But I think this is something to think about as well. But it shouldn't be stopping you to go for a clinical project. And in many ways, I do prefer doing clinical projects because it shows an application to the real world. But I'm not saying that basic research is not important. Basic research is also very important. But I don't think you should be limiting yourself if you come from if you come from a biochemistry degree. If you feel that you shouldn't do a medical clinical project, you shouldn't be limiting yourself on that.
Okay, thank you. So here's a question from C. Lone. He's asking, do you think experience is more important than expertise?
Yep, this is another good question. For me, I think yes. But I think it also depends on what things you do. If you're deciding to stay in academia, you want to be a professor, then definitely expertise is very important. But if you want to work in, let's say in consulting, for example, then people will want to know that you have got exposure to different areas. People want to know that you know a bit more about everything, a bit more about a lot of things, like more generalist, than to go very deep into one subject. So it depends on the job.
Okay, thank you so much. So here's a question from Sharon. So she's asking, is it easy or hard for a medical student to get research experience and get a PhD?
Yeah, thank you. So I cannot answer for the and the landscape in Hong Kong, but in the UK is quite easy actually. There is a lot of schemes that you can apply to. There's clinical fellowship, and yeah, so we have met a lot of medical students. I got students who are from medicine background, and yeah, this is not difficult at all. And a lot of people like to take in, a lot of PR likes to take in medical students. Yeah.
Thank you. So this question is also from Keith-san. So her second question is, she have heard that regarding the development in life science in Boston, Los Angeles, and Shanghai are the best places to develop her life science career. Is that true?
This is perhaps a bit challenging for me to answer because I have never worked in these three settings. But yeah, there seems to be quite a lot of my peers that moved to Boston. Not so sure about LA, but Boston definitely. I have got quite a lot of friends moving to Boston, and Shanghai as well. So yeah, so definitely something to explore.
Okay, so thank you for your answer, also asking questions. So here's a question from Vincent. So he's asking if he can know what will be your future goals in the next 10 years.
Wow, that is a very difficult interview questions. I think I would like to stay in global health. I really enjoy what I'm doing now, and but whether it's going to be with a funder or with an international organization, then that is something that I haven't quite considered yet. And I think it's also important that I'm now very interested in exploring how the public are seeing science, and so this is something I might explore in the future. And like I'm working on vaccines research right now, but there's also a lot of questions to do with vaccines hesitancy, and there's how the public will accept vaccines, why there are people refusing a vaccine. So there's a lot of interesting questions. So I'm still learning at the moment and try to see what would be the best way for me going forward. But I think another personal thing to share is that because of COVID-19, it's very difficult to travel right now. So I think a lot of people are having like a lot of different thinkings about their own career and personal life, and a lot of interesting stuff are going on, but it's probably also important to do something you really enjoy because life is short.
Yeah, true. Thank you so much for sharing. So here is a question from Cecilia Chui. So he's asking, between the industrial research and academic research, he's not really sure about what career is more suitable for his personality and personal values. For instance, he do not like to do research in a very time-competitive way that strives to be the first in the world to discover something. And he also don't know whether he has the right work skills for research publications. So can you comment the main differences between the work values in industrial and academic research? Yeah, I think it's about that part.
I'm trying to read the question, but it's a good questions, and it's very difficult questions as well. I think for industry research, you have to make sure that well, the company will have to make sure that what the money that they are putting into project is going to worth it. So this is probably not surprising that they are focusing on the money aspect of that. And I think academic research is probably focusing more on publications and focusing more on establishing the researcher as an expertise. I think that important things to note is that for both of this different career is something that you have very little control of. I think this is something to realize, that it's very important that you're working on something that you feel like is tailored to your skill set and something that you really enjoy. Of course, the value problem is important as well. Like when I'm working on funder, I realized that I really want to work with people with passion about clinical research. And so I think the value question is important to consider as well, but it's also good to realize that a lot of things is very hard to control.
Okay, thank you so much. So my question is that you also mentioned that COVID-19 has made a lot of people have different thoughts about their future life. And since Wellcome Trust is one of the largest funding providers for science research globally, can you tell me more about what makes you work in the research funding bodies? And how does the Wellcome Trust assist the various healthcare sectors to deal with the COVID-19 pandemic?
Okay, so this is a very, can you repeat the question? Actually, I cannot quite catch the later part. Sorry, James, you are on mute.
Sorry. So the later question will be, how does Wellcome Trust assist the various sectors to deal with the COVID-19 pandemic?
Okay, so thank you. So this is not my job description, so I feel I'm not the best person to answer that. But Wellcome do have a previously has a funding call going on that is available to researchers all over the world that are interested to look at COVID-19, particularly with a view of improving the system in low and middle income countries. So my colleagues are coordinating on that. And I think the key part is for our response in COVID-19 is that we are bringing different we are fundraising to build a bigger pot of money so that we're responding to COVID-19, especially with the population that are not developed countries in mind as well. For my own work, I'm now exploring the options. We're now looking at there are some researchers wanting to do COVID-19 human infection studies. So we have been in a lot of discussions with the WHO and other stakeholders about putting a guidance in place, and also the ethical implication info as well.
Thank you so much. And sorry about the meeting problem. So here's a question from Aida. Aida wonder, are there any scholarship options for a foreign student in the UK? And she is a student from pharmacy.
You're a student
she's a pharmaceutical student, pharmacy graduate. Yeah.
So is there any funding
for scholarship options and funding options for a foreign student? Yeah.
Yes, definitely. So for Wellcome Trust, we got PhD studentship are all for international students, so you can apply for that. And I think that is a few other opportunities out there, like Cancer Research UK. They also do a studentship that are for international students. But I think even that, if you are applying for organization that usually only pay for UK EU students, you can still approach them and see whether there's any funding opportunities that is offered by the university, because sometimes university can cover the difference between the UK fees and overseas fees. So that is also a large part of the money that has taken away from the financial pressure. So it's something definitely worth exploring. I would be happy to take it offline to discuss more.
Okay, thank you so much. So a question from Can. He is wondering what project you think that you really want to do, but you still haven't yet got a chance to.
Yeah, this is good questions, thank you. And I think for now, I'm trying to explore more about the policy side of things, because after being working at Wellcome, I have been starting to do a lot of how to translate research into policy and practice, but I have no experience in policy. So this is something that I am very keen to get some more exposure on.
Okay, thank you so much. So a question from Carol. She is wondering, for a person who are not very creative or innovative, but with good technical research and troubleshooting skills and language ability, what type of career would you recommend? Yeah, thank you.
Yeah, thank you. So I think everyone can be creative. So no need to feel that you are not creative, but I think if you got the technical skills and the language skills as well, one thing you can consider is to be a medical writer. I don't know anyone I don't personally know anyone working in medical writing at the moment, but sometimes I do in some of the projects we do hire a contractor to do some report writing for us, and I do realize that medical writing is quite a big industry in the UK, and the role of a medical writer is you will be helping someone to write something very technical into a more layman term, or the other way around. So if you've got the technical abilities and you've got the language skills, I think this is something that might be worth looking a bit more into.
Okay, so here will be one of the last questions. So as you mentioned that you've been working in various sectors, you've been working in research, you've also been working in funding bodies and also consulting. Can you tell us more about how these the people working in various industries differ from each other? And also what are the characteristics to work in a certain industry?
Good questions, thank you. So I think what I feel, for me, what struck me when I start working as a research funder is that people I seem to be mentioning again and again, people are really passionate about what they are doing. And I think when we were recruiting as well, we do have a tendency of hiring a certain type of personalities. So people who are quite positive, people who can communicate their ideas really well, and people who can communicate really. So I think working as a research funder, because of the amount of work that you have to interact with external people, internal people, and there's a lot of influencing involved as well. So this is like having that people skills is very important. And I think same for a consulting job as well. You will need to interact with a lot of people, but probably a different nature, because you might need to sell project, you might need to keep your client happy, and that might be very different nature, but it's still very important people skills. I think in academia, then I wouldn't say people skill is not important, but it's probably more important that you have that technical ability to do what you are supposed to do.
Okay, thank you so much for answering. And this will be one of the last questions. So, okay, so so she's asking about the Oxford part, about her PhD process. So what are the most challenging part about your PhD journey? And also, did you meet more people during your PhD, and how this is actually supplement your career?
So whether a PhD is helpful?
No. What do you think is the most helpful part during your PhD process? And yeah, and also the most challenging part about the PhD process. Yeah.
Thank you. So I think that my PhD is stressful because it's just have got a lot of uncertainties. I was left on my own for some time during my PhD, and so it was. I think as someone that is in the early 20s, it's quite scary. But yeah, so I think that is and around me, there are people having the same problem. People don't know that when they are going to graduate, they don't know the next step. And as a whole, it's a quite a stressful process when I was doing a PhD. But at the same time, I think it also makes you grow a lot stronger. Like you know what you want to do, and you know what you want to achieve. I think looking back, having a PhD is quite important if you want to pursue a career in life sciences.
Okay, thank you so much. So since time is running short now, so this will be at the end of today's webinar and the end of the HKLSS webinar series, Coronavirus. So if you have any more questions, and also Natalie asked about if she can get an email. So if you have any more questions, feel free to email us at register@hklss.org, which is the same email that you registered for the webinar. We will then compile them all together and help you forward to Dr. Chui for her advice. Once again, we sincerely appreciate Dr. Chui for her sharing today, and thank you all for joining this webinar. Before you leave, remember to like our Hong Kong Life Sciences Society Facebook page and follow us on the Instagram. Again, thank you so much for joining, and we look forward to seeing you again. Thank you.
Thank you, Ceci. Bye-bye.
Bye.
Bye.